Let's talk about the feeding and eating disorders. The DSM-5 chapter on feeding and eating disorders includes pica, rumination disorder, avoidant restrictive food intake disorder, formerly known as feeding disorder of infancy or early childhood, anorexia nervosa, bulimia nervosa, and binge eating disorder. Pica is characterized by the ingestion of non-nutritive substances on a regular basis. Preferred non-nutritive substances tend to vary with age. For example, infants and younger children tend to eat paint, plaster, string, hair, and cloth, while older children often consume animal droppings, sand, insects, leaves, and pebbles. Adolescents and adults with a disorder frequently ingest clay or soil. It should be noted that although individuals with pica persistently eat non-nutritive substances, in order to receive a diagnosis of pica, this behavior must persist for at least a month and not be part of a culturally sanctioned practice. In addition, because chewing on and eating non-food objects is relatively common before age 18 to 24 months of age, these acts do not necessarily signify the presence of pica unless the behaviors are extreme and developmentally inappropriate. Pica generally lasts for several months before remitting, although it may occasionally continue into adolescence and adulthood. The consumption of non-food substances and pica may result in a variety of potentially serious medical complications, including exposure to infectious agents, exposure to parasitic infections such as toxoplasmosis, constipation, intestinal ulceration, perforation, obstruction, and lead poisoning, or poisoning due to other toxic substances. Rumination disorder is characterized by repeated regurgitation and rechewing of food without apparent nausea, retching, disgust, or other gastrointestinal distress. In order to qualify for a diagnosis of rumination disorder, the behavior must follow a period of normal functioning and must continue for at least a month, and may not appear exclusively during the course of anorexia nervosa or bulimia nervosa. Although the disorder may commonly be found in infants, it may also occur in older individuals, especially those with mental retardation. According to the DSM-5, infants with rumination disorder typically display a characteristic position of strain and arching the back, with the head held back during regurgitation, making sucking movements with their tongue, and give the impression of gaining satisfaction from the activity. In most instances, rumination disorder remits spontaneously. In more severe cases, however, the course of the disorder may be continuous. Although infants with rumination disorder may consume large quantities of food, they remain hungry and may suffer from malnutrition as food is regurgitated immediately after feeding. Weight loss, failure to make expected weight gains, and lowered resistance to disease are common in infants with rumination disorder. As many as 25% of the infants with the disorder may die as a result of malnutrition. Rumination disorder is often associated with psychosocial problems such as high-stress environments, neglect, abuse, lack of stimulation, and impaired parent-child relationships. Previously called feeding disorder of infancy or early childhood, avoidant restrictive food intake disorder, sometimes referred to as failure to thrive, is characterized by persistent failure to eat adequately for at least a month in the absence of gastrointestinal or other general medical condition. Onset is prior to age 6 and most often occurs during the first year of life. Inadequate nutrition is evidenced by significant failure to gain weight or significant weight loss, as a child is not consuming enough energy-containing foods, vitamins, and minerals to support normal growth. Infants with this disorder may be irritable, difficult to console, apathetic, and withdrawn. They often display developmental delays as well. In general, early onset, prior to age 2, of avoidant restrictive food intake disorder is associated with greater degrees of malnutrition and developmental delay. Poverty, stress, separation from family, abuse, neglect, and parental mental illness increase the risk of developing this disorder. Temperamental characteristics, intrauterine growth retardation, and pre-existing developmental impairments that cause a child to be less responsive may also contribute to the development of the disorder. In some cases, avoidant restrictive food intake disorder may be associated with negative parent-child interactions during feeding. For example, this disorder may be more likely to occur if parents force food upon their child who are not hungry or who greatly misread child's hunger cues. Anorexia nervosa include 3 essential features. Number 1, persistent energy intake restrictions. Number 2, intense fear of gaining weight, of becoming fat. And number 3, a disturbance in self-perceived weight or shape. The DSM-5 no longer requires the criteria of amenorrhea, that is the absence of at least 3 consecutive menstrual cycles, to be present for the diagnosis of anorexia nervosa. Additionally, the new criteria do not adhere to the 85% of normal body weight norm for age and height. Instead, the term significantly low weight leaves the interpretation open for clinical judgment. The fear of gaining weight has to be present, as well as the presence of poor, inaccurate body image. Specifiers for anorexia nervosa include restricting type and binge-eating purging type. The key distinction between a person with anorexia nervosa with binge-eating purging type and a person with bulimia is a body weight. Once a person loses a significant amount of body weight, the diagnosis changes from bulimia to anorexia, even if they use compensatory behaviors like vomiting or laxatives. If only some of the criteria are met for this diagnosis, then the specifier in partial remission must be used. If none of the criteria are now met after a full diagnosis, then the specifier in full remission is used. Degree of current severity ranges from mild to extreme and is dependent upon the person's BMI. The DSM-5 criteria for bulimia nervosa remain very similar to early editions. Focus is on binge eating, typically within a 2-hour window, of large quantities of food that are consumed in secret. Feelings of loss of control over the eating is also present. These eating behaviors occur at least once a week over a period of 3 months. Also characteristic of bulimia nervosa are the inappropriate compensatory behaviors to offset the impact of consuming large amounts of calories. Excessive exercise, vomiting, laxative use, diuretics, fasting, or other creative methods are used to reduce calories and ameliorate the shame and guilt associated with bulimia nervosa. Binge eating disorder was a diagnosis to further study in DSM-4-TR, but was graduated to a full-fledged eating disorder in the diagnoses for DSM-5. Like bulimia nervosa, the person suffering from this disorder eats large quantities of food in a rapid and out-of-control manner. These behaviors must occur at least once a week for 3 months. However, unlike bulimia nervosa, the individual suffering from this diagnosis does not utilize compensatory behaviors to offset the caloric intake. Specifiers for both bulimia nervosa and binge eating disorder are identical, except that compensatory behaviors are not found in binge eating disorder. Both diagnoses should specify, and a full criteria diagnosis has been met, if their frequency of episodes fall below 1 time per week, which is in partial remission, or if none of these criteria are now met, which is in full remission. Severity of both the diagnoses is specified by a scale of mild, moderate, severe, or extreme, and these categories are determined by the frequency of episodes each week. Let's practice with a question from the feeding and eating disorders key term here. The most likely diagnosis for an infant who makes sucking movements with his tongue, gains satisfaction from the regurgitation of food, and strains and arches his back while holding his head back is: Answer A, autism spectrum disorder, Answer B, rumination disorder, Answer C, pica, and Answer D, avoidant restrictive food intake disorder. The correct answer is Answer B, as these are classic symptoms of rumination disorder. Answer A, autism spectrum disorder, involves a constellation of social, language-related, and stereotype behavior-related symptoms. Answer C, pica, involves the ingestion of non-nutritive substances. Answer D, avoidant restrictive food intake disorder, is characterized by persistent failure to eat adequately for at least a month in the absence of gastrointestinal or other general medical conditions.